Stroke risk after 50 often feels distant until a small daily habit quietly changes everything. Many seniors trust vegetables without question, believing they can only protect the heart and brain. Yet some doctors are raising concern that a few common vegetables may trigger dangerous changes in blood pressure and circulation overnight. These effects are rarely felt immediately, which makes them especially risky for aging bodies. Nighttime is when strokes most often strike silently. Understanding which foods may strain blood vessels is not about fear, but about protecting independence, clarity, and life itself after 50 during later years of health decisions. Staying informed is one of the strongest protections after 50. Subscribing helps ensure important senior health updates are never missed. Liking this video allows others to find this information sooner. Comments are welcome because shared questions help guide future topics focused on safety, independence, and healthy aging for everyone watching. Item number 1. Eggplant, brinjal. Eggplant, also known as brinjal, is often seen as a harmless vegetable, but some doctors warn that it may not be ideal for every senior. Eggplant contains compounds called glycoalkaloids and solanine, which can promote low-grade inflammation in sensitive individuals. In people over 50, chronic inflammation is closely linked to stiffening of blood vessels and reduced flexibility in artery walls. Research discussions around nightshade vegetables note that these compounds may irritate the nervous system and interfere with normal blood flow regulation. For seniors already dealing with high blood pressure, circulation problems, or weakened vessel elasticity, this extra strain can quietly increase stroke risk over time. Doctors also caution that eggplant absorbs large amounts of cooking oil, especially when fried. This combination of inflammation-triggering compounds and excess fats may worsen cholesterol balance, further stressing the cardiovascular system without obvious warning signs. This risk is higher when eggplant is eaten frequently, daily. Item number 2. Spinach, excess raw use. Spinach is widely promoted as a heart-healthy vegetable, but some doctors advise caution when it is consumed raw in large amounts, especially after age 50. Raw spinach is very high in oxalates, natural compounds that can bind to calcium and other minerals in the body. Over time, this may affect blood vessel function and contribute to mineral imbalance. Medical discussions note that excess oxalates may increase the risk of kidney stress and calcium deposits in blood vessels. For seniors with reduced kidney efficiency or a history of circulation issues, this can interfere with smooth blood flow. Instead of protecting the heart, excessive raw spinach may quietly worsen vascular stiffness. Doctors often recommend moderation and proper cooking since heat reduces oxalate content. When eaten daily in large raw portions, spinach can place unnecessary strain on aging circulation systems, which may raise stroke risk without clear early symptoms for many older adults. Item number 3. Beets, beetroot juice, at night. Beets are often praised for supporting blood flow, but some doctors warn that concentrated beetroot juice may not be safe for all seniors, especially when consumed at night. Beetroot is high in natural nitrates, which can cause blood vessels to widen quickly. In older adults, this sudden change may lead to rapid drops or swings in blood pressure. Medical observations suggest that aging bodies do not adjust to these shifts as smoothly as younger ones. At night, when blood pressure naturally lowers during sleep, beetroot juice may push levels too low. This can reduce steady blood flow to the brain and increase the risk of dizziness, weakness, or balance problems. Doctors also note that unstable blood pressure may contribute to clot formation in vulnerable seniors. For those with existing heart conditions, irregular heartbeat, or circulation issues, nighttime beetroot juice may quietly increase stroke-related risks rather than offering protection. Item number 4. Potatoes, fried or refined forms. Potatoes in their fried or heavily refined forms are commonly eaten, but many doctors warn that these versions can be harmful for seniors over 50. Fried potatoes, chips, and mashed potatoes made from processed flakes break down quickly into glucose. This causes a rapid rise in blood sugar, even in people who are not diagnosed with diabetes. Medical studies show that repeated blood sugar spikes damage the inner lining of blood vessels over time. This damage makes arteries stiffer and more prone to plaque buildup. In older adults, stiff and narrowed arteries increase the likelihood of blood clots traveling to the brain, raising stroke risk. Doctors also point out that fried potatoes often contain unhealthy fats and excess salt. This combination worsens insulin resistance and blood pressure control. When consumed regularly, refined potato products can silently strain the cardiovascular system without causing immediate symptoms.
Item number 5. Corn, processed or genetically modified. Corn in its processed or genetically modified forms is frequently overlooked as a stroke risk, yet some doctors advise caution for seniors. Processed corn products such as corn syrup, corn flour, and refined corn snacks are quickly converted into sugar in the bloodstream. This rapid conversion can raise triglyceride levels and promote chronic inflammation. Medical research links long-term inflammation with thicker blood and reduced vessel elasticity. In adults over 50, this environment makes it easier for clots to form and harder for blood to flow smoothly to the brain. Corn-heavy diets have also been associated with imbalances in omega-6 fatty acids, which may further increase inflammatory responses. Doctors note that genetically modified corn may contain residue from agricultural chemicals, adding extra stress to the liver and circulatory system. Over time, this burden can quietly increase stroke vulnerability in aging bodies. Item 6. Tomatoes, overripe or processed sauces. Tomatoes are generally considered healthy, but doctors caution that overripe tomatoes and heavily processed tomato products may pose risks for some seniors. Processed tomato sauces, ketchup, and packaged tomato pastes often contain high levels of added sodium, preservatives, and concentrated acids. These ingredients can irritate blood vessels and place extra strain on the cardiovascular system. Medical guidance notes that excess sodium contributes to fluid retention and elevated blood pressure, particularly at night. Nighttime blood pressure spikes are strongly associated with increased stroke risk in older adults. High acidity from processed tomato products may also worsen inflammation in sensitive arteries. For seniors with hypertension, acid reflux, or weakened vessel walls, frequent consumption of these tomato forms may quietly destabilize blood pressure control. This effect often develops gradually without obvious warning signs, making the risk easy to overlook. Item 7. Mushrooms, store-bought, poorly stored. Store-bought mushrooms that are poorly stored or past their freshness period can pose hidden risks for seniors. Doctors explain that mushrooms absorb moisture easily and can develop harmful compounds when kept too long or stored improperly. These compounds may place stress on the liver, which plays a key role in filtering blood and regulating clotting factors. Medical discussions note that aging livers process toxins more slowly. When liver function is strained, the balance between clot formation and clot breakdown can be disrupted. This imbalance may increase the likelihood of abnormal clotting, which is a major contributor to stroke risk in older adults. Some doctors also warn that spoiled mushrooms may trigger mild poisoning symptoms, such as weakness or dizziness. In seniors with already fragile circulation, these effects can interfere with stable blood flow to the brain and increase vulnerability without clear warning. Item 8. Canned vegetables, all types. Canned vegetables may seem convenient, but many doctors strongly warn seniors about their hidden risks. Most canned vegetables contain very high levels of added sodium used for preservation. Excess sodium causes blood vessels to tighten and stiffen, making it harder for blood to flow smoothly to the brain. Medical research consistently links high sodium intake with elevated nighttime blood pressure. In adults over 50, nighttime blood pressure spikes are particularly dangerous because they increase the risk of silent strokes during sleep. Seniors often do not feel these changes happening, which makes the danger easy to ignore. Doctors also point out that canned vegetables often contain preservatives and lining chemicals that may interfere with hormone balance and vascular health.
Over time, regular consumption can quietly harden arteries and increase clot formation risk, significantly raising stroke vulnerability in aging bodies. Item 9. Bitter gourd, also known as chlorella. Bitter gourd is often promoted for blood sugar control, but doctors warn that it may not be safe for every senior. Bitter gourd contains compounds that can strongly lower blood glucose and blood pressure. In older adults, these effects may happen too quickly and too intensely for the body to adjust safely. Medical observations show that sudden drops in blood sugar or blood pressure can reduce steady blood flow to the brain. For seniors, this may lead to weakness, confusion, dizziness, or fainting. When brain circulation becomes unstable, the risk of stroke-related events increases, especially in those with existing heart or vascular conditions. Doctors advise extra caution for seniors taking diabetes or blood pressure medications. The combined effect may amplify sudden changes, increasing the chance of reduced brain oxygen supply and unexpected stroke risk without clear early warning signs.